Welcome, everyone. We're just going to give folks another minute or so to join. Um, thank you for getting here on time. We'll get started in just a minute. All right, we're going to get started with the webinar here this morning. Welcome again, everyone. Thank you so much for joining. I'd like to start off by quickly thanking my health and wellness team here, Courtney, Caitlin, and Holly for supporting the webinar on the back end and helping to make sure that things run smoothly today. We are recording this webinar and we're going to be sharing the link along with these presentation slides after the call. They will also be made available on the OSSE website as well as directly in our new school health profile application. With today's webinar, we hope to clarify what's changed since last year and share some key to-do items in the week leading up to the launch next Tuesday and just general expectations for the data collection cycle for the purposes of improving the overall data collection process for all of us. Last year, we achieved 100% participation, and we believe that taking this step with this new application will help us to continue building on that success. And our developers and business analysts here at OSSE have been working really hard to help develop this application that not only we hope enhances the user experience for you all, but also helps us to ensure that we're collecting better quality data each and every year. Courtney, next slide, please. So I'll walk us through a few different things today. We'll start with a quick overview of what the school health profiles are. We'll go into what the updates are for this new application. I'll talk us through how to access the new application, and then we'll do this live demonstration where I'll cover several different things, including user access and login, what the school view is of the application, and we'll also cover how to submit data and what to expect from your LEA as well. Throughout the webinar, please feel free to drop any questions in the question box that's different from the chat box, and we will get to them at the very end of the presentation. And please note that your microphones are muted, so you will need to submit or type in questions into the question box if you would like to get them answered. Okay, with that, why don't we dive into our welcome activity? Next slide, please. So if you have your phone, you can scan this QR code, or if you have a web browser open, go to menti.com and type in this code 67196928. Oh, I'm sorry, that code is incorrect. The code is 24499012. Oh, Courtney, we may have different slides open. One second, everyone.
Sorry about that. I'll get it fixed.
No problem. Thanks, everyone. Of course, we're having technical difficulties, but that happens, right? That's all part of the experience as well. Hope you're having a good start to your Tuesday. Thanks for your patience, everyone. Perfect. Thank you so much, Courtney. So everyone, this is the QR code that you can bring your phone out and scan. Or if you have a web browser open, please go to menti.com and enter code 24499012. And I think now might be a good time to jump to the results page because we're getting lots of responses coming in. We have lots of people on this call today. Thank you so much for joining, everyone. That's awesome. I know we still have responses coming in, but in the interest of time, I will move us to our second question. How many times have you completed the school health profiles? Lots of folks that are new, welcome. It's great. There's lots of you here who are new, but there's also a lot of folks that have done this for many, many years. So thank you so much for your responses. Awesome. So I think that's good. We can hit pause on the welcome activity. Hope you feel welcomed, and we can jump back to our presentation. Thank you so much, Courtney, for jumping to that. Awesome. So we'll do a quick overview of the school health profiles, which will hopefully be helpful for the majority of you who this is the first time that you are completing it. So next slide, please. The school health profiles is an annual data collection survey, and it's required for all standard K through 12 schools by the Healthy Schools Act of 2010. I'll refer to this as the HSA moving forward. Since it is required for standard K through 12 schools, this means that schools that predominantly serve adult or pre-K students are not required to submit. And the data that we collect covers a variety of different topics, including nursing and health staff data, minutes of physical education and health education instruction, local wellness policies, school gardens, and so much more. And because of that, the school health profiles is really more than just a data set. And OSSE utilizes it for a lot of different reporting, including a biennial Healthy Schools Act report, which we submit to DC Council every year, or sorry, every 2 years. And last year was a reporting year for us, so the 2022 report will be coming out later this year, which is really exciting. You'll be able to see overall trends and kind of compare your school to the overall district and schools across the district. The data also informs the self-assessment and action planning for schools that are out of compliance with health and physical education requirements. This was something that we launched and rolled out last year, so some of you may remember that work. And the goal of this work specifically is to better support schools and hopefully help improve outcomes and performance year after year. And if you'd like to get familiar with this year's survey, we have a blank copy of the PDF of the survey, which Caitlin can drop in the chat now. So you can also access that through the OSSE website. Next slide, please. In this next section, I'll cover the changes from last year, some to-do items for you to prepare, and some upcoming deadlines. Next slide, please. So what's changed from last year? As I've mentioned many times now, we have a new data submission application. This was formerly what we used as QuickBase, but this new application is going to be a one-stop shop. This will be the place where you complete and submit the school health profile form for the school year. It's also where you can view historical submissions. If you're new, you can go back and see last year's and the year before that and the year before that and the year before that. You can view legislation information. You can view and complete, if it becomes required for you, the self-assessment and action planning resources. And this is also the same portal where your LEA will be able to review your school health profiles data on the certification deadline to ensure that everything is correct, and it's where they will be certifying the data. Another new aspect of the school health profiles this year is that we're enabling a single sign-on login process, which will simplify the whole process of getting access and logging in. And I'll share more on that in just a second. Lastly, just for your awareness, we enabled early access for LEAs on December 5th so that they could begin to pre-populate data and review some of the data that we pre-populated based on last year's survey for them, for the profiles. And they may have already reached out to you about updating the list of users who need access to the application. And if you haven't heard from your LEA yet, maybe now is a good time to just do a quick check-in and make sure that things are ready and that you are ready to go starting the launch of the application next Tuesday. And this segues nicely into our next slide of what you should do now to prepare. First off, you should determine if any new staff at your schools need access to the school health profile application, and you should ask your LEA data managers to submit them to OSSE as school health profile POCs. Now, if you don't know who your LEA data managers are, you should contact your school's leadership to find out. And your LEA data managers, they have the access to the full list of the school health profile POCs and are the only ones who can provide that access. So it's very important to, again, coordinate and reach out to them now. You have a week from today until the application launches on January 17th. So besides kind of determining who needs access, there's not much for you to do. So now might be a good time to think ahead and make a plan. Make a plan, reach out to school staff who you think can best answer questions on, health and physical education minutes, school garden usage, questions about environmental literacy, and more. You can use the blank copy of the PDF to know exactly what types of questions will be asked. And taking even just 15 minutes now to kind of coordinate some of this will, I assure you, make the data submission process much smoother and ensure your timely completion by the deadline on February 16th at midnight. So when you get access on Tuesday, January 17th, that's next Tuesday, you should log in and review the pre-populated data inputted by your LEA. And if you have any questions or if you're unsure of any of the responses, um, this is a good time to reach out to them and determine, who is it that has the most up-to-date data. And the list of points of contact that of the people who have access to your school's profile, that will be available in the application itself, and I'll point that out during our demonstration. Next slide, please. Deadlines. So this is a super important slide. Feel free to take a screen. Starting from today's January 10, so it's the webinar for school level users. In 1 week after the Martin Luther King Jr. holiday, you will be able to go directly to the school health profile application and log in on January 17th. From January 17th to February 16th is the official data collection window. So this is the window of time when you have access to the application, and it's when all profiles should be submitted. February 3rd is the OSSE support tool deadline, OST deadline. This is if you're having any technical issues, any big challenges with the application itself. You should reach out to your LEA data managers, and they can also submit an OST ticket on your behalf. So please do that by February 3rd. By February 16th at midnight, this is a Thursday, 2 days after Valentine's Day. This is when all school profiles must be submitted. You will not have access to the application after this point, so it's very important you get them in as soon as possible, well before February 16th if you can. But again, February 16th by midnight, 2 days after Valentine's Day, they must be in. And this is, we're emphasizing this deadline even more so because on February 17th, your LEA will be logging into the application to certify the data. So they just have 1 day, they have a short window of time to do this, and it'll make their data review process easier if you are able to submit your profile as early as possible. And in March, we will be developing the PDFs for each of your school profiles and sending those out. We'll also be posting them along with the raw data on the OSSE website at that time. So big takeaway from this, remember, February 16th by midnight, 2 days after Valentine's Day, all profiles must be submitted for certification. So I think we can now move on to the next section of how to access the application. So this URL here, data.osse.dc.gov/shp, Caitlin can also drop this in the chat. You can bookmark this, save this. This is the link to the new school health profile application. And please note that it will not be live or ready for you to access until January 17th. Next slide, please. So as school users, you must first determine whether you have access. So the icon that is highlighted in yellow, that's you, you are the school user. If you need to request access, you must first go to your LEA data manager, who will then assign you the appropriate user role. So in this case, the options are school health profile point of contact or school principal. School principals and school health profile POCs from last year, if you completed the school health profile in past years, you are already in our system and you will be able to log in directly into the application on the day that it opens. You don't need to reach out to your LA data manager to be added again. But any new users, you must reach out to your LA data manager to be added to the system. They submit it to us through this system called IDS. And then after one business day, you as a school user will then be able to log into the application directly. There's no notification that is sent out. You just need to confirm with your LED manager that they did add you. And then the following business day, you will be able to go directly to the school health profile application to log in. This is, and the login process, you will set it up using the same email that was added in the IDS system. So this is that single sign-on process that I mentioned earlier. You will then immediately gain access to the application. And yeah, so if you were to do it on a Friday, you would get access on the next business day on Monday. If you did it on Monday, you get it on Tuesday, the next business day. Next slide, please. So how to access your social single sign-on. I've taken a few screenshots of exactly what the single sign-on process looks like. So on starting January 17th, you can go to data.osse.dc.gov/shp and sign in to this box. This is the top screenshot. Um, and since it is a new application, everybody will need to create a new account. Don't click on any of the other buttons. Just go straight to what the yellow arrow is pointed to of sign up now. And clicking this sign up now will take you to the second screenshot below that that says user details. Here you will enter the email address that was submitted to us in IDS. And at that email account, you will receive a verification code, which you will submit here and click verify. After you've been successfully verified, you'll be able to create a new password and add your name, and then that's it, you have your account. And this is a single sign-on process. It's very straightforward and hopefully very easy. Next slide, please. I won't spend too much time on this. These are just some additional considerations to basically not use a different social account to create the single sign-on credentials. You should only use the email address associated with IDS. You will see an error message when trying to log in if your email address is not found. You will also not be able to see the profile in the application itself. This again means that you were not correctly added as a school health profile point of contact. So you'll need your LEA data manager to fix that. After they've corrected any errors in the system, you'll be able to try again the next business day. Unfortunately, there's no way to expedite this process. It's always the next business day. So again, it behooves you to try to practice logging in and making sure you have the correct access before the deadline. And if you're having any technical issues with this process, again, your LEA data manager should submit an OST ticket, and the deadline for that is February 3rd. Next slide, please. So resetting your password, this is now a self-managed process. So if for whatever reason you forget your password, you can just click this button that is highlighted with this yellow arrow. And it's on the main sign-in page when you go to the application, and you can just follow the forget your password process to create a new one. All right, next slide, please. So now we will dive into the demo, and I will share my screen. All right, so again, I will navigate to the portal, and since I already kind of explained how to create a new, uh, sorry, my computer is freezing. Sorry, everybody, 1 second. Okay, sorry about that. Since I already walked us through how to create a new one and I have my account, I'm just gonna go ahead and log in directly. Hit sign in. This is just a consent form that you can read. I'll hit agree, and this will take you to the landing page. And here you will see 5 modules available. The first one is called School Health Profile for current school year. This is where you can access your school's profile and submit the data for this year. This next one is called Historical Submissions. This is where you can access past years' profiles. This next one called View Legislation Details. If you're curious at all about anything related to the Healthy Schools Act or what the requirements are for any of the questions, you can access that here. These last two that are grayed out and say coming soon will be enabled later. One is for the self-assessment and action plan, and this other one is for reports. So other features on this homepage, there's this widget here at the top, and this has a few rotating messages. When you click this arrow here, you can see this is a summary of the key dates to keep in mind. When you click it again, this is a hyperlink to the OSSE website where you can find all the instructions. This is another place where the webinar recording will be posted. And it's also where we have an FAQs document. This FAQs document is linked up here as well as in this menu bar. So this button with the 3 dashes right here, when I click that, it opens a menu bar. We've been on this home page, and I'll just jump to this FAQs tab so you can see what that looks like. We have 3 different categories of frequently asked questions. The first is just general information, so kind of context of, what the school health profiles are, information on which school staff might best be able to answer certain questions in the school health profiles, and much more. Then we have a tab for school level users. So this is questions specifically related to your view and your connection to the school health profile. So these are the login steps. What do you do if the application denies access? Again, this is just a summary of mostly what I'm covering already in this webinar, and it should serve as a helpful refresh if and when those questions come up. There's also a tab for LEA level users. And while these answers may not be specific to answering your questions, there could be information here that is helpful just as context for you and what your LEAs have access to and what they're able to do. So I will navigate from the menu back home, and I'm going to click on the school health profile for the current school year. So at the very top here, you will see your school's name. And to the right of that, you'll see something called survey status. Now there's a total of 4 possible survey statuses: not started, in progress, submitted for certification, and certified. All of you will start as not started, and that will change to in progress as soon as you change any of the data and save that data in the application. And when you've completed and submitted your profile for certification, the status will then change to submitted for certification. And finally, on February 17th, after your LEA has reviewed and certified the data, the status will then change to certified. The button to the right of this with an arrow pointing down is where you can download a blank copy of the survey questions. Again, this is also available on the OSSE website, but for ease of access, we also have it linked here. And this is also where you will download the PDF, the final PDF for your school's profile when that becomes available in March. So below your school name, you will see two tabs here, one called questionnaire and another called points of contact. Under points of contact, this is where you can see everybody who has access to your school's profile. So I'm listed here. For the purposes of this demo, I'm serving the role of school principal, but there will also be school health profile POCs at the LEA level, school health profile POCs at the school level. You'll have your LEA head of school. You'll have all this information. So if you have any questions, and you're wondering, oh, what information was changed and why is this answer pre-populated here, you can find everyone's email addresses and contact them through this tab. So I think I've covered most of the features here. Again, just for your context, LEA level users can see all of the profiles of all of the schools within your LEA, and they have the same edit privileges and ability to see how much progress you've made on the profile throughout the data collection period. So they'll be able to submit any answers or clean anything up that you need support with. So I will go back to the questionnaire tab now. So right at the top here, you'll see a bunch of donut charts. There are 7 in total, and each of these shows the percent completed for each of the 7 sections of the school health profiles. So there's a graph for school profile, a graph for health services, health education, physical education, school nutrition, distributing information, and lastly, environment. And you'll notice that some of these percentages will be greater than 0. Now, the reason why is, again, we've pre-populated some data based on last year's survey, and your LEAs have had early access and may have pre-filled some more. So most of mine are at 100% because I prepped it for this webinar, but the percentages will differ based on each of your schools and how much your LEAs have completed. So below these percentages and tabs to each of the sections, which you can click and navigate to different sections with. There is a box called legislative instructions. So if there's anything legislatively mandated or relevant to that section, you'll find that here, which will hopefully make it easier to see exactly what the requirements are. And if at any point either of these two features are getting in the way, you can minimize it here and hide progress here. So we are currently on section 1, and you'll notice that most of these response boxes are grayed out. And this is because we pre-populated this general information on your LEA name and school code and grade served based on what we already have in our OSSE databases. So that's why it's sitting at 88%. The last step for you to do is to just hit this box at the very bottom. That will bring this section to 100%. Now, if you're going through any of this grayed out information and you notice an error, please contact your LEA data manager to submit an OST ticket to us. Now, since this section is mostly complete, I would recommend on January 17th, when you're testing your login capabilities and ensuring that you have the right access in order to complete the school health profiles for this year, I'd recommend just going in, clicking this box, and then hitting save, because this will move your profile from not started to in progress, and it will bring one of your sections to 100%. And that can hopefully be encouraging and get the ball rolling. So you should always be saving your information as you go through the school health profile with this blue save button, which is at the bottom of every one of these sections. So as I mentioned, for this demonstration, I went ahead and I completed all the other sections except for section 4 so that we can walk through how to complete it and submit the profile together. So My recommendation is that as you go through the data, if there's anything that you're unsure of, or you think that the LEA may have made an error, or you need to go and search for that answer and come back and update it later, just go ahead and remove that data. Just leave it blank, because that'll make it clear that that question still needs to be answered, and it's better to leave it blank than to have incorrect data and accidentally submit that to us. The application will also not let you submit any data with any errors. So for example, let's say for this first question of, for each grade span in your school, please indicate the average number of minutes per week during the regular instructional school week that a student receives physical education instruction. This does not include recess or after school activities. Let's say I accidentally fat finger it and I put 3,000. I will automatically get an error message that says, please enter value less than or equal to 450 minutes. So whatever the instruction is that is specific to that question, that is what will show up in this error box. And you'll be able to then hit OK, go back, and change the answer to what it was supposed to be. Now, to bring this section and any section to 100%, you need to keep in mind three things. One, there must be no errors. Two, all of the required questions, those marked with this red asterisk, must be answered. And three, when both of these conditions are met, the select to complete this section box will no longer be grayed out, and you'll be able to click it and then hit save and complete that section. So I'll just show you again. If I don't have a response to a required question, I'll see an error message here that says a selection is required. So this is telling me that, this question is a required one. And also this select to complete the section box will be grayed out. I will not be able to complete it. I will be able to save it again, because you can save the profile at any point, and you can leave it blank if you need to go get the answer. But if you have the answer, you can just select it. So I will select to complete the section and I will hit save. Now, because I had previously completed the other six sections of the school health profile, I'm now getting this notification. Thanks for completing all sections of the survey. Once you're ready to submit, click the Submit for Certification button at the top. I'll hit OK, and I'll scroll back up here, and I'll see that this button is no longer grayed out and is ready for me to click. So one important note, as school level users, once you click this Submit for Certification button, you will no longer have edit access to the application to make any changes. Only LEA level users, so your LEA data managers, your LEA level school health profile POCs, and your LEA head of school will have access and can make any changes until the certification deadline on February 17th. So if an LEA level user does make any changes after you've submitted for certification, the profile will return to being in progress. Again, the survey status will be listed here. It will change from submitted for certification back to in progress. And that's how you can know if your LEA made any changes. You will not receive a notification if it switches back to in progress. Only if it was resubmitted for certification, that's when you will get a notification. So this is the likely scenario to keep in mind, perhaps in the days leading up to or on the date of the certification deadline, because the LEA head of school will be reviewing the data, and if they need to make any changes, they can make those changes and then resubmit for certification. If you have any questions about why a profile was resubmitted by the LEA, or what questions or data was changed, you can reach out to them directly. And again, the points of contact tab will show you exactly who your LEA data managers are and who it is that you can reach out to who may have edited the profile. So since I'm at 100% for each of my different sections and I'm ready to submit, I will hit this button and I'll get a confirmation reminder. Are you sure that you want to submit the survey for certification? Users with school principal role or school health profile POC school level role will no longer be able to edit the survey. So I know this and I'm ready, so I will submit it for certification. And I see this green box, survey submitted for certification. So that's my notification that it was submitted. And I will also get an email confirmation when you've submitted it for certification. So again, the deadline to submit your school health profiles is midnight on February 16th, and your LEA will be logging in to certify the data on the day after on February 17th. So the sooner you submit it for certification, the more time they'll have to review the data ahead of that certification deadline. On that deadline date, your survey status will change to certified when they review and certify the data, and you'll receive an email notification when this happens. After this, it'll take us about a month to generate the PDFs, and you'll receive a third and final notification when those are ready for download. So I walked us through quite a bit, but I hope that you were able to keep up. And again, this webinar recording will be available for you to go back and see exactly how I clicked each of these buttons. And this will conclude our demo for today. Courtney, I'll pass it back to you to share your screen again. So I know we covered a lot in the demo, but please remember that this is recorded, and we also have an FAQs document and an instructions guide that are both currently available on the OSSE website. Caitlin can drop both of these links in the chat so that you can bookmark those as well. Some final key takeaways to just keep in mind. Right now, all you need to do in this next week before the application is available on January 17 is to determine any new staff that need access. Please leave blank any questions that need to be updated or that you do not have the answer to. And this is better than just leaving the response from last year. After the school health profile has been submitted for certification, you will no longer be able to make any changes. Only your LEA data manager or LEA head of school or a school health profile POC at the LEA level can make those changes. So uh, if they do make any changes after the profile was submitted, the profile must be resubmitted for certification, which is something that they will be responsible for doing. But if you are concerned at all, you can always log into the application to check the status and see if it's in progress or still submitted for certification. You, as school level users, will receive 3 notifications throughout the data collection period. You'll receive the first when the profile is submitted for certification. You'll receive another when the LEA head of school certifies the data on February 17. And lastly, you'll receive a notification when the PDF is ready for download in the application. Some final key deadlines to just keep in mind. February 3rd is the OSSE deadline for any major glitches or technical errors that you're facing. On February 16th by midnight, that's 11:59 p.m., the schools should have submitted their profiles for certification. On February 17th, from 9 a.m. to 5 p.m., that's the regular data certification window. That's when your LEA head of school will go into the application and certify the data. So next slide, please. We'll now go through some of your questions. Give me a minute to just open up the question box and we'll see what folks may have been asking. Okay, whenever I try to log into the school health profile application, the screen does not load. I've been using the following link. That's a great question. So as of now, as a school level user, you will not be able to log into the application. Again, you will be able to log in when the application is live for you on January 17th. The only people who have access to the application right now, since they've had early access, are your LEA level users. So that is why you may have been unable to log in. Also, the recommended browser to use is Google Chrome. So please download or use that for the school help profiles. Who is the LA data manager for DCPS? So there are two people, Christina Sheen and Gina Chieffo. I can share those email addresses to you directly, but maybe those names ring a bell already. Um, they are the point people, they're the liaisons for DCPS that you can reach out to. So there's someone at the LA level who is able to set up a login, but when they enter the uh, school health profile link, they get a screen that is blank except for the school health profile application at the top of the screen. So my recommendation would be, again, to try logging in through Google Chrome. My second would be to clear your cache and to just remove any like history that may be preventing you from accessing the application. And if these don't work, I would recommend submitting an OSSE ticket directly to OSSE so that we can look into it. So our data manager assures me that a member of our team was entered as the school level POC, but that employee does not appear in the POC list. Um, I would say for this, please submit an OST ticket just so we have it on record and we can look into it and work with you directly to help resolve this specific employee's access, because there could be, maybe an issue with the email address or something, but we can look into it. Just please submit an OST ticket. So what happens after you have submitted for certification? Who certifies it next? The head of the LEA or the data manager? So the LEA head of school, who will be who is already aware that they do data certification for multiple surveys, not just for the school health profiles. They know what to do on the date of the certification deadline. So after you submit your profile for certification, they will be able to log in directly on February 17th and hit certify. Can the LEA head of school certify prior to the February 17th deadline? No. So the uh, data certification process is a pretty formalized process. If you're at all interested in more context for it, Caitlin can drop in the chat the link to our data validation process, but it's only available from 9 a.m. to 5 p.m. On the date of the data certification deadline, not prior. Um, So I see a specific question about who an LE level user is for a particular school. Please just email us directly and we can best assist you with that. So what's the purpose of the profile? If I'm understanding this question correctly, the school health profiles is mandated by the Healthy Schools Act of 2010. So it is an annual data collection that is required for all public and public charter schools that serve K through 12. And the legislation is available on the OSSE website if you'd like to know more about why we collect this data and what data we collect. So how is the data used? That's another great question. I covered some of this in my initial slide, um, but we use the data again for our reporting purposes. Uh, as I mentioned, there is a biennial, so an every 2-year report that we submit to DC Council that summarizes all of the information related to health staff coverage, school gardens, health and physical education minutes, these different requirements that are listed out in the Healthy Schools Act. That is what we report on. And you can see trends over time. Since we have been collecting this data for over a decade now, we have a pretty rich and robust data set that is just, really informative to understand, how our schools across the district have been progressing, and and yeah, and again, there's also the self-assessment and action planning that focuses specifically on physical education, health education, and physical activity minutes, and is our way of providing support and ensuring that we're able to help schools that need it to meet the minimum requirements that are required by the Healthy Schools Act. So I think I've gone through most of the questions in the chat box. Um, I'm sure you will have many more questions in the coming days. So please continue to read through the FAQs document. Check the OSSE website. We've really updated it with many resources that can help you and give you the information that you need. And if you have any more specific questions, feel free to reach out to me at osse.schoolhealth@dc.gov. Um, this will conclude our webinar for today. Thank you so much for joining. We will be sending out an email with all of these resources and more. And I really look forward to working with you on another successful school health profile data collection season. So thank you and Happy New Year. Have a great rest of your Tuesday. Thanks again.